When palpating the osseous structures of the foot, we usually treat the foot in two parts, the medial foot and the lateral foot. So for the simplest palpation that we'll be doing in this class, we will start with the obvious bony landmark, of course, being the medial malleolus. The medial malleolus and the lateral malleolus are much larger than you expect, and they're very lumpy and groovy and all kinds of little nodules on them. Don't be concerned with that. We are most concerned with just the shape of it and where do we go from there, because this is going to be our home base. From our home base, with the foot in neutral position, we are going to come straight inferior to the medial malleolus, and that is going to be, you'll feel a hard structure right below it, but then something hard, something hard, something hard, and then you feel just soft tissue from that point on. So from this point on, there is no bone. So we have about that much of a fat pad for the heel of this person's foot. So coming straight down from the medial malleolus, we are going to feel the last bony structure. That last bony structure, we can invert, evert, and feel, yes, sure enough, we are on that last bony structure, and that last bony structure is the sustentaculum tali. From that structure, we can come directly forward or anterior or continuing along the foot, straight line, and on this patient, it's very prominent, not on all patients, but we come to the next bony prominence, and that is the tubercle of the navicular bone. Now that is going to be an important bone when we look at the arches of the feet. From that bone, going from the medial malleolus to the sustentaculum tali to the navicular tubercle of the navicular, we are going to move down the first ray or first toe. So when we do that, the next bone we come to is going to be the medial cuneiform. Now, some textbooks call this the medial cuneiform. Some books will call this the first cuneiform. Then we're going to wiggle to make sure we're on it. We're going to wiggle the first metatarsal, and that approximates with the medial cuneiform. From that point, just like the fingers, the toes are identical to the fingers in shape and size, shape and location, is we come to the base of the first metatarsal, and the base is concave in shape. Then we move down the shaft of the first metatarsal to the head of the first metatarsal. And the head of the first of the tarsal bones and phalanges are convex. Then we move to the phalanges, same with the base, shaft, head, base, shaft, head, with all of the toes. Looking at the bones of the lateral and prominences of the lateral foot and ankle, we will start with the lateral malleolus. The lateral malleolus, again, may be bumpy and groovy and little nodules on it, depending if they've sprained their ankle in the past, but knowing where it is, that is going to be our obvious bony landmark. Coming dorsally or anteriorly, the top of the foot, we will actually grab between the medial and lateral malleolus the talus, and then we are actually grabbing, you'll feel a big ridge, especially on the the lateral aspect of the talus. And this is called the dome of the talus, and we can actually rock that dome in and out of the ankle mortise, and you can feel it slide. Sliding just distal, we come on to the neck of the talus. That neck is going to be an important palpation and anchoring system for mobilizing the talocrural joint in later courses. So, moving back to the lateral malleolus, coming straight down, we actually barely get a little slice of the talus. It comes straight down to the calcaneus, and there's a little tubercle there that is on the lateral aspect of the calcaneus, more prominent in some people than others, that your calcaneal fibular ligament attaches to. Going then from that calcaneus straight forward, or you can go ahead and jump ahead and find another obvious bony landmark, the tubercle of the fifth metatarsal. Either way, between the tubercle of the fifth metatarsal and that calcaneal tubercle right there is the cuboid. Now, that cuboid is sometimes largely covered up by the extensor digitorum brevis. And so it may be some soft tissue there. From the cuboid, the cuboid approximates with the base of the fifth and fourth metatarsals. So we will palpate the tubercle of the fifth. That is your base, shaft, head, as we looked at of the big toe. And then from that, we are going to palpate the only two bones left, and that is going to be the middle or second and third cuneiforms. The second or middle cuneiform approximates with the base of the second metatarsal. So we just follow the base of the second metatarsal up until it drops off onto the middle or second cuneiform. The lateral or third cuneiform is we palpate the shaft of the third metatarsal until it drops us off into the third cuneiform. So that we have on this structure, we have palpated the lateral malleolus, the lateral tubercle of the calcaneus, the cuboid, tubercle of the fifth, the third cuneiform, the second cuneiform, the dome of the talus, and the neck of the talus.